My sister-in-law, Joan Bursick Dawson, was diagnosed with pancreatic cancer at the young age of 38 when her 2 children were 3 and 2, her daughters. What was amazing in this day and age, when everything is available on the internet, is that in 1996, pancreatic cancer wasn't even on the radar screen. I just felt that somebody had to make a difference. Nobody else should have to go through what the Bursicks went through. And luck would have it that I met Jane Holt, and we decided that we were going to start the National Pancreas Foundation and be the one and only foundation that covers all diseases of the pancreas. Currently we have 21 chapters and we're growing. We are literally coast to coast, and I'm pleased to say that we have supported almost $3 million in leading edge research, which is providing hope to our patients and hope to our physicians.
So, I think one of the greatest things I think about the National Pancreas Foundation is that it's an organization that has a really kind of personal connection to these diseases. And so, like many nonprofits that take care of diseases of patients, there's these people who are involved. It's a mission. Then they really want to help. It's an organization where when you're diagnosed, you can reach out and find support, and other people have been through it. It's great to have organizations like NPF trying to find a cure, but also trying to support your patients.
The National Pancreas Foundation has a very important role when it comes to patients, because they need an advocate for them rather than serving a healthcare system or the specialty of a specific doctor that they may go visit. The National Pancreas Foundation has also been a great partner in Pancreas Fest. Pancreas Fest is an annual meeting where physician scientists who are dedicated to studying the pancreas and making progress come to Pittsburgh to discuss advances and to learn the latest scientific and medical treatments, and to learn to work together as a team to solve problems that otherwise are unsolvable.
Well, I think that the National Pancreas Foundation can play several roles for patients who have pancreatic disorders. I have my own personal bias, and that's that they play an important role in representing children who have pancreatic disorders. There's only one other organization that I know of that even includes children in their approach. The National Pancreas Foundation is focused on children and the effects that it has on families who have children with these disorders.
I came to be involved in the National Pancreas Foundation purely out of frustration for the lack of cure for the disease. As you know, pancreatic cancer affects over 45,000 people per year, and it's actually related to over 45,000 deaths per year. One thing that we've been offering has been that of the National Pancreas Fair that we have, and it's an opportunity for patients to come and meet physicians one-on-one and talk for as long as they would like about the current experiences that they're going through with their disease. It offers a very good low-stress environment for a patient to be able to discuss with their physician regarding all aspects of their disease.
The NPF has a number of roles, both in pancreatic cancer and in non-malignant disease and pancreatitis, and they offer an incredible array of services. And so having these resources to show them what they might actually undergo is invaluable for them. It's really been an amazing thing. The National Pancreas Foundation local chapter here has actually been one of the movers on the national level in terms of supporting grants, and they've also taken upon themselves to support local grants.
So the NPF is a great institution where they are providing young investigators like myself with funding to help fund new and important work in not only the management of pancreatic cancer, but early detection strategies. And so the NPF has been heavily involved in funding our project in molecular testing in early detection of pancreatic cancer and its precursor lesions.
When I was 24 years old, I was living in Dallas at the time, and I'd been going through about a 6-month period where I just really hadn't been feeling well. I'd been having some digestive issues, and I lost 10 pounds in a month for no real reason. So I went to my doctor, and they told me that it was probably just stress because I was only 24 and it was in good shape. But they did a CT scan because I'd lost weight, and so they did one just to be safe, and that's when they called me and told me that they found a mass in my pancreas, and they thought maybe it was just a cyst, and so I had an endoscopy and biopsy done a few weeks later, and received a call one night, and my doctor was out of town, so a nurse called me and explained to me that I had a solid pseudopapillary tumor in my pancreas with cancerous tissue. And she couldn't really answer much else than that because my doctor was out of town. So it was a little scary, to say the least, when I received that phone call. But I went and saw another doctor about a week later, and he explained to me that it was a very non-aggressive tumor and that there was a 95% cure rate with surgery. So I felt extremely fortunate to be diagnosed with a tumor in my pancreas that actually had a great prognosis.
He found a tumor on my pancreas, and my gallbladder was a complete mess, and that's why I was itching. He biopsied everything right away, and I had an adenoma of the pancreas. In all the 20 years since I was diagnosed with pancreatic cancer, there have been many, many breakthroughs and many different medicines out there, and I think that people have a much better chance of living longer now than they certainly did when I was diagnosed 20 years ago.
We can't do this without the help. The National Pancreas Foundation cannot do this without the help of everybody who's here at the gala, as well as in supporting them in this mission or so. It's not an easy mission. We don't think it's going to happen quickly, but we have to make small, steady steps towards that ultimate goal of helping these patients.